respiratory arrest. You have an allergic reaction. Can you speak?
Can you speak? Can you speak? Chase literally just called out a respiratory arrest and the woman is choking on her own airway and Foreman's asking, can you speak? On this channel, we are on a mission to react to all 177 House episodes. This will be season 1, episode 10, Histories, that was recommended by Aidan Closer. Let's see if I can get the diagnosis before House does as a doctor working in London.
I didn't touch him. Great. Oh, we gotta go to the hospital.
Interesting, so our underdressed lady just passed out while looking for a man named James. Who is James? Why is he at an underground house rave? Why did a random woman try and kiss her with a pill? Because it makes for damn interesting television. That's why. But do I have the answer? No, I do not. Seems like she was reacting particularly badly to the flashing lights. That can be a trigger for epilepsy. So she may have been having partial seizures since she didn't have the dramatic limb jerking and eye rolling that we would see with generalized seizures. Let's get more clues.
Homeless, admitted 24 hours ago with a suspected drug overdose. Her tox screen's clean, but she's still delusional. I noticed a twitch. Her wrist.
She's manipulating me.
Ooh, if she's manipulating Wilson, then she's 110% committed because not everyone can just let their hand smack their face. That's how they see if a patient is unconscious or not. If they're conscious, they'll stop it. I hope it's obvious that we don't use this method much. What's much better is to say, we're about to get the rectal diazepam. And if they keep going through that, then they're almost certainly not faking. Now, the patient is homeless, which leads to so much stigma in healthcare because A&E departments are disproportionately filled with homeless patients because of their high risk of drug use, alcoholism, tuberculosis risk, which she could full well have. They take less care of personal hygiene and vitamins, and so more at risk of skin infections and nutrient deficiencies. They really are a vulnerable group, so it's really important that we treat them just like other patients so they don't end up with drastically different healthcare outcomes, although that may be inevitable.
Blood sugar's 38.
Fake low blood sugar. Now that's acting.
He took one look at her and figured it was a scam. He just wanted her out the door.
What's the differential for a twitch in the wrist?
I thought I just discharged her.
What is going on? House is responsible, Foreman's reckless. I thought we were watching House, not Freaky Friday. Now, as a junior doctor, one of the most frustrating things is when someone asks you for a decision and then goes straight above your head to your boss for another one. I once had a 29-year-old homeless patient who I reviewed and actually decided to keep her in hospital, but she really wanted to go home. And then when the consultant, which is our equivalent of attending, came around, the patient completely changed her story. She then got discharged. What can you do?
A twitch could indicate a brain tumor.
If you're so worried about it being a brain tumor, get her an MRI.
Who is she?
Looks just like insulin.
Still moist.
Did he just lick vomit off his fingertips? Cut the video. I'm about to lose some electrolytes. Alright, some interesting points here. Now the focus is on the twitching, and there are plenty of things that could cause twitch, but the first I would be looking at is electrolytes. So deranged calcium, potassium, sodium, or magnesium could even cause convulsions as well, but wouldn't really explain the glucose, although if she's been vomiting and she would be losing potassium and not eating, that could lead to low glucose and deranged electrolytes. I would be doing some electrolyte levels of blood gas to check pH, and she could have lost some acid, and her blood counts, kidney function, blood-borne virus screen like HIV or hepatitis, especially since she has needles in her bag, and then take it from there.
Salty. Chemical imbalance. Hang a banana bag, give her 24 hours to correct the electrolyte imbalance. We'll take it from there.
Who's James?
Whoa! Foreman was trying to hold her down and she mistook him for dinner. They wanted to find out who she is, and now we know that she's probably a cannibal from Papua New Guinea. I also can't believe that House just diagnosed a potassium deficiency from the taste of her vomit. I really shouldn't have eaten before this episode. Now she's got a banana bag, which must mean potassium since bananas are high in potassium. But why not do just the blood tests? Please someone just take her blood? Foreman, see, she's taking yours. Okay, I've got a question for you smart people. What brain-eating prion do cannibals get? Drop your answers down below.
Good news is she's negative for HIV and Hep C.
Yeah? I'm getting a tetanus shot. She's getting an MRI.
The CT scan shows she has a surgical pin in her arm.
Oh, could he say here that you can't do an MRI in this lady because she has a surgical pin and it would rip out of her arm like an Alien movie? That's about as real as my guitar playing talent. Oh, this thing's dusty. Now, most surgical pins have actually taken into account MRI compatibility and are made with titanium alloys. Also, MRI machines won't rip out things. They actually just cause slight movements within the tissue and they heat up. So orthopedic implants generally don't cause problems because A, they're well secured, and B, they are around tissues that aren't that heat sensitive. So the things that are more likely to cause issues are things like non-MRI compatible pacemakers, cochlear implants, brain aneurysm clips, metal coils or stents in blood vessels, or even neurostimulators, but they have MRI safe versions as well. What could bother her more than her metal implant is how loud the MRI machine is. I've been in there and it sounds like a repetitive, loud thumping sound. Kind of like my upstairs neighbors on a Friday night.
We'll surgically remove the pin, then do the MRI. Does that sound good?
I know where she keeps her stuff. Just bats.
She's allergic to indextran.
Wow, okay, a lot to go through here. Foreman found a series of drawings of unclear significance. What's more interesting is that House didn't actually care about the MRI head that much. He just wanted it as an excuse to remove the pin from her arm and discovered that her name is Victoria Manson because of the serial number on the surgical pin. That's actually how pathologists identify bodies sometimes when the body isn't in great condition for DNA analysis. Seems like Foreman has now given her some iron, which she's allergic to. This reminds me of a time when I was working in A&E and I saw a 55-year-old female. On the initial triage notes, it said she had no drug allergy, and since she was septic from a chest infection, I went ahead and gave her coamoxiclav through a drip, which is a penicillin antibiotic. She was quite confused at the time and wasn't able to answer questions clearly. Afterwards, when her partner came, I found out she was penicillin allergic, even though that wasn't on the records. Fortunately, it was only a rash previously, and she actually had no reaction to the antibiotic I gave her, and she improved fairly quickly from the treatment. Close call, but good learning points. You have to be so careful with allergies and really never trust what is written down. I always try to ask where I can. Now, if you're enjoying this video and would like to support the channel and get access to some exclusive perks, check out the channel membership. With it, you can suggest a series, an episode for me to react to, and you can get early access to new videos. I also want to say thank you to all members for supporting me. So for a limited time, all new members will be enrolled in a raffle for £100. So make sure to press join below to secure your spot now. Back to the video.
Respiratory arrest. You have an allergic reaction. Can you speak?
Can you speak? Can you speak? She's literally just called out a respiratory arrest and the woman is choking on her own airway and Foreman's asking, can you speak? That wouldn't happen in real life, but I can see how it adds to the drama here. Now, this is anaphylaxis and this patient needs adrenaline to help reverse the allergy and get her throat to open. Most patients with anaphylaxis do recover, and in the US, about 5% of the population has had anaphylaxis in the past. The survival after an event like that is 98 to 99.3%. That's good news for Foreman's medical license.
Neoplastic syndrome associated with the cancer could cause her to twitch like a bunny on crystal meth. Ultrasound her ovaries.
Working hard?
Interesting potential diagnosis here from House. Although ovarian cancer doesn't usually cause paraneoplastic syndrome, and when it does, it causes peripheral neuropathy, which can cause weakness, loss of sensation, but not twitching. Twitching is an involuntary motor sign that comes from the brain. This is really a difficult diagnosis to track down, to be honest. So what do we know so far? She's got anemia, twitch, previous depression and frostbite. When faced with tough groups of symptoms to link, We can use something called a surgical sieve to come up with potential diagnoses. The mnemonic Midnit was actually used in the second ever episode of House Paternity. M in Midnit is for metabolic, so it could be porphyria. I is for inflammatory, it could be something like Isaac's syndrome, which is a rare neuromuscular cause of involuntary muscle firing. D is degenerative, so it could be things like Huntington's disease, presenting with chorea, not the country, it's a symptom of involuntary movement. N is neoplastic, could be multiple myeloma. And the second I is infective, so tuberculosis or encephalitis from sleeping rough. Could be Coxsackie virus, herpesvirus, or enteroviruses. T is for trauma. Unlikely though, as then it's not reversible and the MRI is normal already. So we need more clues.
So who pissed you off?
I thought you could do some teaching. Patient histories.
I think House just wants to prove she's sick, so Foreman will be wrong. She's got cancer.
So why does he hate the homeless people?
Oh, this is getting spicy. We have another clue. She has an ovarian mass. So maybe it's a cancer, maybe not. There is a condition called Mycobacterium syndrome where they've got a benign ovarian tumor and then also got fluid buildup in the abdomen and chest. After you take out the benign tumor, the other symptoms go away. Nobody knows why it happens, but it doesn't quite explain the twitch. Or it could be a cystone, she has multiple in her spinal cord, and maybe she bled into one causing the anemia. Now I'm excited to find out why Foreman dislikes homeless people, although it may not help though that she now needs a toothpick to get bits of his arm out of her teeth.
Solid non-cystic mass on the left ovary. Central necrosis. There's nothing we can do for her here.
Unless it's not cancer. What if it's a tuberculoma? Start her on INH, rifampin, and streptomycin.
Damn it, House, you took the words right out of my mouth. Classic tuberculosis is caused by Mycobacterium tuberculosis. It's a very interesting drug because you can't see it on a usual Grand stain since it has a special cell wall that doesn't absorb the dye. Instead, you have to use a Zeal-Nelson stain and it takes ages to discover because it's so slow growing. Generally, slow growing means hard to kill, as they have a low metabolic rate and so low uptake of external resources. So the treatment for tuberculosis takes 6 months, 2 months of quadruple therapy of rifampicin, isoniazid, pyrazinamide and ethambutol, and then drop the last 2 for the next 4 months. So 6 months total of rifampicin and isoniazid. Now here's an interesting thing though. If she had TB and a necrotizing granuloma, cleared it, and now that granuloma could be filled with a fungus, aspergilloma could be causing her symptoms, or she could have something like Pott's disease, which is a complication of tuberculosis where it spreads to the spine and maybe causes this jerking. Let's find out.
I took too much insulin on purpose. I really wanted a place to sleep. The light's bright. Oh!
It's not a tuberculoma. The lab results from the biopsy, it's definitely a tuberculoma.
Foreman is just getting pummeled in this episode. First, he wants to send this very unwell patient home when she's sick, and he gets bitten by her. And now he's wrong about the diagnosis. Foreman's day is going about as smoothly as a bird into a window.
Uh-oh.
Okay, our patient's got new symptoms. Fever and photophobia indicate something called meningism. They've already done an MRI of head and found nothing, so it's time to do a lumbar puncture to find out what this is. Meningitis can be caused by bacteria, viruses, fungi, parasites. If she's got a tuberculoma with low immunity, I would definitely want to know what her HIV status is. Maybe she's got cryptococcal meningitis or histoplasmosis, which you can get from bat droppings. We saw earlier that Foreman was looking through her stuff and a bunch of bats came out. That's how she could have got the histoplasmosis. Meningitis on its own doesn't quite explain her symptoms though. So there are also some bat-borne neuroviruses that could cause her symptoms and explain all of them. So very spicy diagnosis that would fit here is rabies. Could also be Hendra or Nipah viruses that are other neuroviruses carried by bats. I'd definitely be treating her empirically for meningitis with ceftriaxone roundabout now. It's also interesting to hear the backstory here and just how desperate life on the street is. Sitting on the other side is very difficult for us to have empathy for some of these patients, and it's so easy to actually just attribute all their problems to drugs and alcohol. That might be true for some, but I'm sure we'd have a different perspective if we had walked a day in their shoes.
She could have picked up an infection on the streets.
The Prozac we gave her could have triggered serotonin syndrome.
Send blood and urine cultures and get a chest x-ray. Put her on bromocriptine for the serotonin syndrome.
Serotonin syndrome, spicy diagnosis, very interesting. Although infection still on the cards, and my top bet still, either histoplasmosis, rabies, or one of the other neuroviruses I mentioned from the bats. So what is serotonin syndrome? You probably know serotonin as the happy hormone, but when too much of it builds up in the brain, it can cause neuromuscular, autonomic, and mental status dysfunction and symptoms. The reason why Cameron thought of it here is because of the high fever, which is a neuromuscular symptom because of the increased muscle activity due to the serotonin. Others include tremor, hyperreflexia, muscle spasms, dilated pupils, agitation, mental confusion, restlessness. Generally, it's either caused by an overdose of a serotonin increasing drug or a combination of two drugs that increase serotonin. There's no specific test for it, and most cases don't need hospitalization, and stopping the drug can just fix it. The big error here though, bromocriptine is not used as a treatment for serotonin syndrome, as it's actually a partial agonist at serotonin receptors, meaning that it could make her symptoms worse by activating more serotonergic neurons. For severe symptoms, supportive treatment will help each of the effects that the patient has, like benzodiazepines for agitation, paralyzing the patient and intubating them if they've got a high fever due to the muscle contraction, and putting them in an ice bath if all of that doesn't help. Antipyretics like paracetamol or acetaminophen in the US don't work because the temperature set point by the hypothalamus isn't increased. If that doesn't work, then histamine antagonists like cryptohenidine can be given, but it isn't really well researched. So let's see what the team does here.
Lumbar punctures reveal elevated proteins in white count.
It looks like meningitis.
They're in isolation and stutter on ceftriaxone.
She was sedated.
She's gonna die out there.
Bacterial meningitis, highly contagious.
Interesting. So Cuddy's worried about the infectivity of this meningitis, but we know that the gram stain in the CSF actually was negative, which rules out Haemophilus and meningococcal meningitis, which are the contagious ones. The others really aren't of considerable isolation risk. The others aren't of significant infective concern really, and don't really need ongoing isolation. Also, even though House says ceftriaxone, which is how it's pronounced in the US, Hugh Laurie would say ceftriaxone, as it is in the UK. Scientists love playing with us when they name these drugs. The patient getting up for a casual walk in the middle of sedation reminds me of when I was taking a 3-year-old child to the MRI scanner. We'd given him a strong dose of lorazepam to keep him still in the MRI machine, and we were halfway through the scan. He just gets up and starts stretching like it's time for breakfast. Some things actually make you harder to sedate, like increased anxiety or fear, or genetic polymorphisms in that drug metabolism pathway.
Pulse 150. Rhythm regular?
Yeah, he was just passed out on the grass.
Supraventricular tachycardia. Give me adenosine, 1 milligram IV push.
What would push her heart rate over 150?
Very impressed here. Usually ECGs are sketchy in medical dramas, but the supraventricular tachycardia shown on the ECG was accurate. The thing that isn't quite there, but it's very subtle, is that when you give adenosine, the heart actually stops for a second and then goes back into the right rhythm. There's no gradual reduction like House showed on the ECG. The patient experiences that stop in their heart as if the world is going to end. It works very well with the abnormal rhythm terminating in about 90% of patients. Before that though, usually we would try something called vagal maneuvers, which stimulate the rest and digest system to slow the heart down more naturally. Vagal maneuvers include things like blowing into an empty syringe and carotid sinus massage of the neck. They sometimes work, but not as commonly though. You do look like a genius when it happens though. I remember once I had a 37-year-old female patient with a supraventricular tachycardia that was drinking 7 cups of of coffee a day. I walked in, gave her a syringe to blow on, told her to try and push the plunger back using just the force of her breath, which is impossible, by the way. And bam, she cardioverted straight to sinus rhythm. It was pretty satisfying. Sepsis could have caused the supraventricular tachycardia here. In reality, you wouldn't look too much into it unless it would carry on after the infection is treated.
It's still meningitis.
It's a taser.
What does it do? Fire about 60,000 volts? At least that's what it would take to jack someone's heart up to 150. That's all my friend, Ben Franklin. The heart rate thing's not connected to her condition.
Interesting! So you see, supraventricular tachycardia is a re-entry arrhythmia, and that's usually caused by the signal going in a circle from the bottom of the heart to the top of the heart, rather than it terminating at the bottom like it should. Tasing can cause defibrillation that actually helps to break that circular process. And House is saying that the tasing caused this SVT. There are no reports of that in the literature at all. Another question for you smart people. What things can cause your heart to go into a funny rhythm? Drop your answers down below.
The cop tasered her right about here. She didn't feel the taser. Is that where she bit you?
What the hell?
Yes, come on. Okay, so rabies. Bats are a huge reservoir and the most common cause of rabies deaths in the US. The virus is in bat saliva and can be transferred through bites, which our patient would be susceptible to. She then bites Foreman, gives him the rabies virus and causes his numbness. You can test her saliva and her serum with PCR, which is a DNA amplification technique, but you can give rabies immunoglobulin and rabies vaccine if you catch it immediately after exposure. In real life, rabies actually carries a 99% mortality rate, so hopefully they find an experimental cure, otherwise we're seeing zombie Foreman in future episodes.
Ineffectiveness of sedatives and hydrophobia.
Rabies. There've only been, what, 10 cases in the last 20 years? There were bats.
Called it! Yes! I got the method of transmission and the diagnosis. I will take that. But I really shouldn't celebrate though, because it means that our patient is almost certainly going to die. Considering how long it's taken them to get the diagnosis, the rabies virus is extremely deadly and works by replicating in muscle cells after a bite. It then transmits itself to motor and sensory nerves in the area and climbs up the center of the nerves into the spinal cord and brain. The process is called retrograde axonal transport, and hers would already be in the brain. Luckily, as Chase said, there are only 1 to 3 cases a year in the United States. They may still be able to save Foreman with immunoglobulins and a vaccine, but in reality, he's already showing a sensory deficit and his mortality rate would be approximately 99% as well. The chances of the virus transmitting to an infected person to another is theoretically possible, although there haven't been any cases published of that happening, although there have been cases of it being transmitted through an organ transplant. Ouch.
She's dying.
You don't get your shots in the next, say, 3 hours. I'm going to have to make another affirmative action hire. I don't want her to die alone.
You're going to find James.
I'm going to try.
Interesting. I'm not sure why House is so confident that Foreman will survive this with just a vaccine, as the odds are not on his side since he's already showing symptoms. Foreman must be feeling immense guilt now though, after wanting to discharge her at the beginning. I hope we find out the real reason why he was so hesitant to treat her and thought that she was manipulating them. This episode really teaches us a valuable lesson on not to just put people in a box and assume things just because of their initial appearance. That can be difficult as a doctor sometimes, as common things are actually common, and in reality the patient would have almost certainly died anyway, as rabies would be extremely difficult to diagnose and in the real world probably would have been found post-mortem unless there was a clear history of an animal bite, which there wasn't here. House makes it seem like Foreman could have saved her if he diagnosed her sooner, which adds to the drama, but I'm really very doubtful of that. We still don't even know when she got bitten. Excited to see who James is though, and seems like Foreman is going the extra mile to try and support her, which is nice to see.
Paul, her husband.
And who's James?
Her kid.
It's like Dad.
Damn, I see why this episode is called Histories now. This poor lady is alone, homeless, after having a family, and she's been left by society to carry on her own. Such a sad state of affairs. This is why some of the happiest countries, like the Nordic countries, have an extremely robust social security system to look after the most vulnerable. You need socialism to help the vulnerable. You need capitalism to foster and encourage creativity. They're like yin and yang, and the countries that truly understand that prosper. So much of health is determined by things independent to healthcare, like income, wealth, educational level. It's hard to exercise every day if you're worried about where your next meal is going to come from. This is such a good episode. We'll rate it 7 out of 10 for accuracy, 8.5 out of 10 for entertainment, and 10 out of 10 for the diagnosis. Beautiful.
They're dead. Car crash. She was driving. It's Paul. I've come to forgive you.
I'm so sorry.
How could anyone live with that much guilt? I love to see how Foreman's transition from hating the patient to dealing with her most deep regret at the end there. What a provocative and beautiful thing to do. It's also really interesting to see that character development here. In another scene, we saw that Wilson had a homeless brother, and that's why he cared about this homeless patient so much. That connection really helped him to do the right thing. I got the diagnosis in this one. Do I get it in the next one? Find out here. Stay curious.